it's a big lifestyle change when you get alpha-gal. There's no more of the things that we get accustomed to enjoying around here in the Ozarks. We're a big beef area. Obviously, there's a lot of deer hunters. I'm a deer hunter, and I don't get to enjoy that anymore. And so, you know, it's something to take very serious.
As a physician, I actually share the frustration, right? I mean, I'm a dermatologist. We have good medicines. Medicines work. When patients come to me with almost any problem, from a bad skin rash to like a skin cancer, we can solve that problem within short order. Alpha-gal is the exception. I mean, I found there just wasn't a lot of literature to go around. And there's been a couple people who've been working on this for a long time, and we're all following their footsteps, have done great work. But there's really only a few different groups, and the problem seems to be getting worse every year.
When he was diagnosed with alpha-gal, it was a lot. We'd already cut dairy because I was allergic to dairy at that point, but just figuring out his medications and the hidden ingredients and all of those things was just incredibly overwhelming.
Yeah.
We felt like the traditional medical system wasn't there to really help.
We don't have good solutions, and so I think physicians actually share that frustration. You hear stories all the time of patients being like, I begged my doctor to get the test, and they just would not order the test. So I hear those stories. It's I don't exactly know why there's so much reluctance in medicine. I think part of it is the lack of awareness and understanding. You know, that just comes from being a new condition. It's new. It's just not in the textbooks. We just don't know how to handle it. And we don't have evidence-based treatment. So that's where the real frustration is as a physician, because that's what you want to be doing. That's what we do in medicine. We have very high standards for what meets the criteria of a safe and effective medicine. And we have a great deal of confidence in those, because then when we use them, like I said, in dermatology, they work great. But nothing in alpha-gal has really met that standard. So when you have a patient get his diagnosis, as a physician, you don't have much to offer. And that's an uncomfortable place to be in as a physician. We don't like it, patients don't like it. And unfortunately, it just takes time, right, to come up with that evidence-based solution. It just doesn't happen overnight. And alpha-gal syndrome has kind of emerged. I mean, it's been around a long time, but it's really exploded in the last few years. And so it just, unfortunately, will take some time for us to have the kind of treatments that meet the standard of good medicine. We do have good data that if you apply DEET to your skin, or apply picaridin to your skin, or apply permethrin either to your skin or your clothing, that you'll reduce the number of tick bites. And that's important both for people who don't have alpha-gal syndrome, because tick bites are a risk factor for developing it, and also people who do have alpha-gal syndrome, because we think avoiding tick exposures may improve your symptoms over time.
And sometimes prevention isn't always the best. He had permethrin and DEET on, and he still got another Lone Star tick bite the other day. And so it's like doing regular tick checks after you're out in the field or you're out in the barn when you come home. Keeping your animals, like your indoor house pets, if they go outside, making sure they have their proper, flea and tick preventative on them, because you don't want them bringing that into your house. And just being really mindful of the dangers of tick-borne illness in Missouri right now.